we're celebrating National Nurses Week and the incredible roles that they play in patient care, especially during one of the life's biggest moments, welcoming a baby. Joining us is Dr. Teresa Baker, along with Hillary McBride and Courtney Terrell. So thanks for joining us, ladies. So tell us a little bit about, just the importance of nurses and the roles that they play in our lives.
So I invited Hillary and Ariel because people don't really realize how much of a team effort this is in medicine now, and especially on a unit like labor and delivery. We really rely on their critical thinking and their skill set to really help us have a good outcome. And they're really our eyes and ears there at the bedside when we can't be there.
So ladies, tell me a little bit about celebrating National Nurses Week and I guess the roles you guys play when it comes to delivering a baby.
So as a labor and delivery nurse, we take care of mom and baby and support them during the labor process. We're there for them most of the day at the bedside, whether we're, coaching them through a contraction or just there for their family emotionally, physically, mentally, any kind of support they need. We're there, we're their right-hand man, we're their advocate. We're pretty much doing everything that they want and make sure their needs are met during the labor process.
And so tell me a little bit about, I guess, when it comes to, that's a really big, important moment in somebody's life. So what does it mean for you to be by their side during that time?
So when we're by their side, we're their biggest cheerleader. Like Hillary said, we're their advocate. We really take into account their wishes and their plans, and we try to do everything we can so that they have a positive experience and that we have good outcomes for mom and baby, but also in the safest way possible.
And Dr. Baker, what does it mean to celebrate National Nurses Week and give these nurses praises when it comes to this week?
So what people don't realize is this isn't a job for these women. This is a calling. It is the best of the best on labor and delivery, but it's also getting through tragedy, and it's a lot of emotional wear and tear, but they do it because they love it. And we all need to say thank you more. I need to say thank you more and be very thankful for their skills and everything they bring to the table as well.
And ladies, tell me a little bit about, this week. I mean, I know that, nursing is a hard job. Mm-hmm. So tell me a little bit about, what you guys hear from people, maybe not just this week, but all the time when it comes to nursing.
We get a lot of thanks. Our patients are super appreciative, but mostly, we take care of a mom and a baby at the same time. And so most people don't realize that, but our patients are so appreciative of what we do. And a lot of people don't realize what we actually do until they're in labor, until they have delivered a baby. It's a complex process, and there's a lot that goes into it that people don't realize. And so after they deliver, there's a lot of thanks and a lot of, I didn't know I needed you, but you were there for me, and that is why we do it. That is exactly why we do what we do, is for that right there.
And I think all aspects of nursing too is just so intimate. So we're like, y'all were saying, we're there for, patients' best days and their worst days. And so when somebody's crying, really we're crying too behind the scenes, even if we have to have a serious or a straight face in the room to take care of complex situations, we'll go home and we'll cry with that patient as well. And then something also to remember too is that nurses are people and have families, mm-hmm. and we go through these same things as well sometimes. So,
well, ladies, thanks for joining us, and happy National Nurses Week. We have more at Studio 4 after this.